Okay.
Welcome, everyone. Hello, hello. I'm Suzanne Wagner here with Andrea White. Andrea, give a wave for session two in supervising street outreach staff and programs. And we're so happy to be here in our evolution and our walk with outreach teams along the way, alongside of you. I'm going to hand it over to Molly Machado, our fearless leader at Demas on all things street outreach, to welcome everybody.
Hi, good afternoon. I see some of my favorite faces here, so welcome. Um, a lot of you were here for session one, so you already know the goal here is for you to get whatever you are hoping to get out of the session. So ask questions, um, make a new friend. If someone says something really smart and you're like, wow, that's really great, if you don't know them, I'll tell you their email address. I would love for you to be able to connect with each other offline if you don't already know everybody on the call, especially folks from different parts of the state. So, all questions are good questions. I am, as always, happy to hear real feedback about things that are not working in your community. So, feel free if something here also doesn't jive with your experience, let's talk it through. Appreciate you all being here and everything you do every day.
Thanks,
Thanks,
Molly.
Molly. And Shannon, forgot to introduce Shannon is here with us, Shannon Quinn Sheeran from Housing Innovations as well. And we are just thrilled to be supporting street outreach. If you haven't run into us yet, we're doing a lot of monitoring, tool making, and training support for street outreach in Connecticut. And Andrea and I are social workers and practitioners and had a lot of experience. Been around quite a while, but really respect and value your work. And especially as a supervisor of outreach, it is a really, really tough job. And
Yep.
we talked last time about all the roles and all the responsibilities that you have as a supervisor in outreach. But what's great about Connecticut is that you actually have supervision and supervisors, and it's built into the programs because it's so essential. Today, we're going to pick up on some things about adult learning and then some things that are really specific to outreach. But we hope that they're spark ideas, like Molly said, make new connections, share what you've learned. I know we always have a lot of veterans on this call, people who've been doing this work for a long time, and better than anybody. So we love to see your faces. If you want to come on camera, I see all these people on camera. Cindy and BB and David, I didn't get to call you out before. We love to see you, but we also get that you may not be camera ready. Special ways you want to be addressed, just type your screen name. You can change the name that's underneath your picture by rolling up to the top, and there should be some three dots there. We do have a couple of polls and we have a couple of breakouts, but we love to talk. And you guys have been really engaged and sharing during the course of the training and the session. So don't hesitate or wait for a request for input, but raise your hand, put your something in the chat and get our attention. Let's talk about it. So I think some people might already be reading ahead on the slide, which is fine with me. So we can't really introduce ourselves because that will take the whole time, but put your name, your agency, the location where you are, and what you like most about spring. And I'm just gonna have to say this year, it has been the flowers because that's an everyday wonder. The flowers. Okay, come on. Oh, daylight savings time. Yeah, love that too. Good walk in
I
the
like the
park. The
ice
ice
cream
cream
truck one.
trucks.
Ugh.
Yeah. Okay, that's a good one too. Wearing open shoes, no socks. How about that? Getting the garden ready. Love it. Okay, we've got people from all around. Okay, gardening.
Baseball games. There we
Baseball.
go.
Okay, we were waiting for baseball. Yeah, daylight savings time. So if we were to have a vote on who wants to keep daylight saving time or keep the standard time as the year-round time, which is a continual debate in America, I think I know how this vote would go here, this crowd. Okay, getting the kids outside. Yeah, warmer weather. Okay, well, hopefully that gave you a nice little warm feeling. For me, thinking about flowers, warm weather makes me feel good. I know it's Thursday. You've already had a long week. We want to make you have some good thoughts, and also one of the goals also make you laugh. So we'll try and make some jokes along the way. If you don't, and we know some folks don't have a microphone, on their phones, on their computers. So you can participate by phone, take a screenshot if you don't have the slides. They are in the chat, if you want to download them, but you can call in on your phone. But it is not one touch. It's a lot of touches because I've done it. So take a screenshot. Okay, so just what did we do last time? Because a lot has happened in the last 7 days. We talked about the Kadushin model of supervision. We gave you a reference to a great book that reads well, that really breaks supervision into administrative, educational, and support functions, right? And thinking about the jobs you're doing with staff and the roles you're taking, are you paying attention to the administrative, which is, I think, pretty self-explanatory, the educational, which is really building skills and knowledge, and then the support piece, helping people manage the work, not get burned out, develop professionally, and thrive in their jobs. So we also reviewed the goals of supervision and the roles. If you remember, there was somebody who had a lot of legs and arms, because that's kind of the description of your jobs is to be doing so many things. And we talked about using team meetings. We talked a lot about individual supervision since, thank goodness, individual supervision actually happens in Connecticut. So we talked about structuring those meetings. We talked about structuring team meetings, case reviews. And then we also talked about some really specific things about outreach supervision, which say we're going to do the same thing today and, really talk about the work that we need to do as supervisors to help people with housing and community resources, and then training and self-care. So we got a poll for you. I can find it. Yeah. So what supervisory interventions have you used since the last session? So the last week. One-on-one supervision meetings, team meetings, case reviews, modeling interventions or role plays, chart audits, documentation reviews, building connections, a long one, building connections to community resources or clinical consultation, advocating with the agency for your staff and your program, modeling and promoting self-care. I hope that one gets a lot. I hope to see a lot of you did a little modeling and promoting self-care, arranging or providing training for staff or orientation or other, because we know there's other. And Zoom only gives us a list of 10. That's the max, no matter how much money we pay them. The polls are limited. Okay, I got a couple smiles. Thank you. I appreciate you. Okay. About half of you. Oh, I see some of you are in a group, but we have about half of you. We'll give you a few more seconds, about 10 more seconds if you want to weigh in on what you've been doing. I know it's a lot to read. It is multiple choice, so I don't feel like you have to force yourself to think too hard. Okay. All right. I think we'll end the poll and we'll share the results. So 75% of you almost have been doing one-on-one supervision. Two-thirds of you have been doing team meetings. Half of you have been doing case reviews. Um, Half of you have been modeling, and more than half modeling and promoting self-care. Yippee-dee. And then providing training or arranging that for staff. That's great. And then a quarter doing some connections to resources, and 20% of you doing some chart auditing. I know everybody's favorite supervisory task, monitoring the charts.
I gotta say, I love the document
But that,
review. Yeah.
yeah, but that you do, oftentimes not on a weekly basis, but it's good to see individual supervision is happening every week, and team meetings too are really frequent. Molly, you look like you're talking. Do you want to say something?
No, I just love to see so much individual supervision. That's really, really great.
Yes.
Really, really good to see that support for staff.
Absolutely. Absolutely.
Mhm.
Thanks, Molly. Okay. Great. So it's a good reminder too of things to think about. Do I have this on my calendar? And I'll say about chart auditing and stuff like that. Usually you do that maybe on a monthly basis or a quarterly basis or something like that, depending on your program. So what are we going to do today? So today we're going to talk a little bit about adult learning and how people learn, right? And what we know about, because a big part of the job is teaching staff. We're often in outreach, street outreach, we may be getting workers. Hopefully we're getting people with some experience, but we're often getting people who don't have a lot of experience or limited skills. So we want to really be thinking about giving them opportunities to learn, and we're tackling it at different ways because different people learn different ways. And then we'll kind of loop back on some of the specific stuff we want to think about in street outreach in terms of housing and resources, specifically safety. We want to go a little deeper on safety today. We mentioned it last time briefly because you can't really talk about outreach without talking about safety, because that's the goal. One of the big goals of the work is to, of course, get people housing, meet their basic needs, but to do it in a safe manner. But we'll talk about that today, workload management, and then using some of the training resources. And then we have a lot of resources at upcoming events to announce to all of you. So just points about adult learning, and some of you might have studied this in school, but adults and children don't learn the same way. If you're a teacher of children, you learn certain pedagogic principles when you're studying, but there are different principles when it comes to adults. So we have a couple of different things about adult learning. But the main thing about adults is that they're motivated to learn because they want to solve a problem or meet a need they have, right? Not that there isn't learning for learning's sake, but most adults are too busy or very busy and really are motivated because and even that, learning for learning's sake is meeting a need that they have for learning. But they're looking for some information and specific information. It's goal oriented. I want to learn more about taking care of my health, right? It's that practical advice that they can use right away. Adults are also self-directed. They will read more or look for more. We just are doing a training series in Connecticut, and we have a learning management system, and we can see, oh, you guys aren't, we're in Connecticut today. Sorry, Andrew and I've been in a lot of cities this week. We were just in Vermont this morning, but for PSH, and some of you may be using it, but there's a learning management system for permanent supportive housing and shelters. And people are going in there, and some people are like doing all 18 trainings all at once. So they're self-directed very often, adult learners. They're also task-oriented. What do I need to know to accomplish this task or solve this problem? And adults bring a lot of experience. And the more we can hang the knowledge on things people already know, the easier it's going to be for them to retain that knowledge. So we want to think about, what do people know? So you think about a woman that Andrea and I used to know in a restaurant, also known as a bar, who managed people in that place with just grace and ease. And if you know what a bar can be like, it's not always the easiest place to manage folks. And she was amazing with people. And the first thing he said was, "Do you want to be a case manager?" She would be great at it. She had really great skills, and people have experience in other fields that they bring to this that we want to build on, right? And that ability to listen, to connect, to read a situation. Oh, great. Thank you, Molly. Is part of what adults bring to the table. So as opposed to a 5-year-old who doesn't know their alphabet, adults are bringing a lot to the table already. Another thing to think about is kind of a reasoning, logic approach. How do people learn? And this is helpful for me because I tend to be a deductive learner, which means kind of going from the general principle, and then I get the general principle, and then I see it coming out in individual cases. So in this example, it's kind of a top-down approach. So people who've been abused can be slow to trust other people, right? So it's a general concept. The deductive learner learns from the example. So they see a lot of people who are not able to trust, and then they notice that there's a lot of abuse in their backgrounds, right? So it's kind of going from the case to the cause, or the general to the specific. What the big point is when you're looking at these slides is sometimes telling a case or showing a case example is the best way, or modeling an intervention is the best way to teach somebody how to do it, right? By seeing an individual example. And last time I shared that my supervisor hospitalized someone who needed voluntarily to go to the psychiatric hospital, and I was in the room and watched it. And I learned from that case, and I'm a deductive thinker, but I learned from that case something I could generalize to many, many cases. I was listening to her, responding to her distress, supporting her, offering her the ability to feel better, all of these things that if I would say, what are the 5 things you want to be thinking about in that situation, which would have been my normal way to do it, but I saw it from inside that work. So thinking about using both when you're teaching people and teaching people based on kind of their orientation to learning. So we got a quick poll for you guys about your own learning styles. And you don't have to be one or the other because it's a reasoning approach, right? It's a way of thinking. But where do you lean most? I know many people are going to say both because that's what happens whenever we do this poll. Do you lean a certain way? Do you want to go out on the edge and say you're more deductive than inductive? Do you want to say other? I don't want to learn anything anymore. I'm tired of learning. Sometimes it feels like there's so many things to learn every day.
Okay.
It's okay to be both. But if you tend to lean one way, it's good to know because I think also what we know often from with direct service staff is they are more likely to learn from a case than from the concept, right? And that's something just to think about, even though we may be thinking, I get the concept and then I get it. I look for it, I see it. That people may need to really think about that a different way. Okay, so we have share the results. A little more than half of you. Okay, so about a third came out as deductive. I'm right there with you, but sometimes inductive.
Yep.
Less than 20% are inductive, and both about half of you. Yeah. And it's like I said, it's not one way or another, maybe depends on the situation, but we generally have a style. And as a supervisor, I think we want to tune into what's our style and does that mesh with the worker style, right? The worker may be different and may need a different way of being taught. And then the last thing, just to talk about adult learning, is also to think about what are the modalities we're using? What are the different ways we're presenting new information to people? Are we lecturing you like I am right now? See how effective that lecturing is in terms of learning? 5% of people of what what you hear in a lecture you retain. Would that be fair? By the time 2 hours passes after this training, you've run 100 more miles in the day. And what we said is only goes so far, which is why we encourage people want to read. You retain about 10%. AV visuals, that's why we've had a lot of pictures because some people, the visual really gets them. Our visuals aren't always that great. Demonstration, 30% of what you see demonstrated, you retain. So if you see somebody do something and you observe that. Discussion groups, 50%. That's why we're using discussion groups in these sessions, because that's a way where you're really interacting with the content and with other people, which makes it a more meaningful experience. Of course, practicing by doing things. There's nothing like it. I know we talk about role plays all the time in training, and then people kind of say they want role plays, and then when we say we're going to have a role play, people go, "Oh, we really hate role plays." But role plays are great if you can have a comfortable environment to do it in, where you feel safe to screw up. Excuse me, sorry, we're recording. Where you're comfortable with that person giving you critique. But I just know I just did something really hard in my life and I role played with someone, and it was really helpful. And I was agonizing. I know how to practice, how to train. I kept practicing one on one by myself, but it really helped to practice with someone there who could really listen and give me feedback. So, anyway, there's a shout out for role plays, but we know you got to be safe when you're doing it. And then teaching others, 90%. So if you teach, you learn what you're teaching, right? And we're always learning. Andrea and I are always, and Shannon too, we're always adding new content, always looking for new content. We're always thinking about things in different ways. And teaching is a great way to learn. And it's a great profession. I talked about this last time. It's a great professional development opportunity for staff.
Yeah.
Some staff want to be trainers or want to learn how to be trainers or are natural trainers. I just met a woman who is so, just kind of had the training personality. and she will be great. And she is interested in training. It's a different city. I do remember which city it was, but thinking about how can you use your in-service or your in-house training program to do special topics, to give chance to staff who are interested in training an opportunity to do. Could be many trainings, could be 10 minutes in the team meeting, could be, brief opportunity, could be longer. But it is, I just want to give that a shout out because I think that's really how a great way for people to learn. So I'm going to pause there. I don't see anything in the chat on any of this. None of this is very controversial. Much of it is known by all of you, but we're going to have a chance for you guys to talk a little bit about what kind of assistance your staff are needing, what you're seeing in terms of the gaps in knowledge and skills, and what practices are working really well. Is the training working out? Is supervision really working? Are you doing anything exciting or special in your agency you want to share? And then any challenges. And these are just questions, prompts. You are adults, you'll talk about what you want to talk about, but first introduce yourselves to one another because these are new groups. Is anybody's in a group? I see Destiny, Fune, Terrell. Fine. It looks like there are two of you in the room.
Okay.
Okay, so you'll want to join a group? Is anybody a whole team in a room? Because I know sometimes we create a separate room for separate teams. No. Okay. We're going to pause the recording. Okay.
Welcome back. Thank you, Shannon.
Thanks, Shannon. Welcome back, everybody. Welcome back.
We were
how
still
did it go?
talking. We were still talking, Suzanne Wagner.
I'm sorry, Sylvia. I was going to immediately apologize because I saw a couple of our groups really talking over and so excited and talking so much, and then a couple groups looked more done. So we kind of split the difference. So I apologize, Sylvia, for that. But hopefully, the last time we talked. So what came? So Sylvia, do you want to share something?
I think, what's really interesting is, we talked, one of the first things that came up, we think is an area that people need the most help with is case conferencing, is an understanding what that practice is.
Mm-hmm.
And what is helping with that practice, which I brought as a practice that helps with it, but it also is still the area, is the warm handoff, the transition. And, because the warm handoff or that transition is such a point of frustration, that it's a great opportunity to be teaching what case conferencing is, which is relatively simple. It's talking about what's going on, who's going to do what, and what's the plan basically, and who has what to bring. So it kind of fits in with adult learning because it's something that you're motivated to learn. But that kind of came up in our discussion too, is we got to stay on that whole warm handoff business too.
Yep. Well, thank you for that point. I think a warm handoff is a great opportunity to teach and to learn. And then the case conferencing is a great learning how to present a case and, skill, and then discuss it and using that process to figure out what to do. It's a really good way, and it gets at more of learn by doing things, right? It's really more engaged than just reading about it or having someone tell you do it. Anybody else want to share what staff are needing help with, what things you're doing that are really working or maybe exciting? You guys are so shy.
I'll share.
I know, I don't. All right, Stephanie.
Stephanie.
I'll just say I'll share one thing that I've started for probably the past 6 months. They always do monthly supervision. But when I really started to dive into charts, I saw that there was a lot of confusion, right? Not understanding around the documentation and, other lot of nuances that comes with outreach. So I actually meet with my team individually 30 minutes every single Monday, where we kind of really go over like, great, did you complete this? Are you having any issues? Does this make sense? how I can support that. And, through that, I've definitely have seen some improvement as well. And it also, I think, gives staff an opportunity to identify kind of where they're struggling
Yep,
in that moment and allows me to, kind of, you know, be more aware of those struggles early on too. So I'll share that
great.
that's
Thanks for
how I've seen
sharing.
Great.
that.
Yep. It's structuring in that time to make that, you've identified something that needs a little more attention and you put in place a structure to give it more attention. And then and staff are using it for that time. So it's a great, great example. I heard this from Michelle Condorino. I don't know if anyone's here from our organization, but um, this isn't necessarily about learning, but I think it's about motivation, is that then some of you might know this story, but they're using an agency all staff email when people get housing.
Yes.
Anytime a person gets housing, they just do, and in accounting gets it, and HR gets it, and not just and the executive director. Well, she's the executive director, of course she gets it. But everybody gets it and sort of gets a shout out. And I think when I think about what does staff need assistance with, I always we want to think about how we can make them feel good as much as possible and feel successful. And, in a team-based model, every time somebody gets housing, hopefully the team can kind of embrace that and use that to motivate them to move forward. Because that's a big part of what people need in supervision. And I don't know what you guys are finding, if you're finding skill gaps or what you talked about, but once you've, like, I think Stephanie was a really good example, was or identifying this charting as an issue, and documentation in in this staff group, it's not their favorite thing to do. They want to do outreach, right? So that's a really good example about kind of drilling down. Anybody else want to say anything or share anything? Give us a tip. Okay, so Andrea's going to pick up
Yeah.
on some of the stuff we really want to talk about that's specific around the outreach work.
So one of the things, picking up on the previous conversation, is that one of the things is when Michelle was saying that she was sending this email to all the staff about when somebody gets housed, part of that is reinforcing the focus on housing and the focus on outcomes. And that one of the things that we want to do as supervisors is really help people do that. And part of how we do that is making sure people have the correct information on what the housing options are. Case managers, supervisors too, tend to be a little controlling, and having the wrong information really short circuits people. So we want to make sure that people understand what it is, and what are the housing options and the program options and the expectations of tenancy, and that they're fluent in discussing it. What's the staff going to do? And as Sylvia said, it leads into that warm handoff. We also want to help people have housing problem solving conversations. And we've done some of that. We actually have a chart that helps people have housing problem solving conversations. I think that's really, it helps people to give people a structure, how to negotiate that. And what we're doing is trying to expand people's options and teach them those problem solving skills. It's also making sure that tenants get, or that people get this information from a couple of different places. So one of the most effective things that people can do, and I know it might be tough to do a group with outreach, but if people get together at all, or some people are using a local church and maybe a dinner or a soup kitchen, is having those tenancy skills trainings and hooking them up to resources at the same time. So I'll give you an example is sometimes people get legal aid to come in and do a tenancy group. People like that. They're not hearing it from their case manager. They can discuss those, and also the legal aid can pass out cards at the end of it so that they have a resource and they've met that resource. The other thing is helping staff to understand landlords' roles and the housing process, and what's going to happen once they're there, and that functional separation of roles. And then it's also really paying attention to how people are moving through the process, recognizing progress and problem solving barriers, and also that staff doesn't internalize It's a big challenge for supervisors oftentimes, and people take a couple of steps backwards, which, let's face it, everybody does, right? It's hard for staff not to see that as a failure on their part. So it's helping people debrief it. So it's not just, it's modeling the debriefing process with your own staff so that they can do it with the clients. It's also helping staff prioritize, focus on the most critical staffs, critical tasks. It can look pretty chaotic when you've got somebody who is so in need. When people are outside, they have a million needs. It's helping people prioritize, and it's also that conducting of case reviews. And as Sylvia said, that's a hard thing to do, but um, it's something that staff really crave and they love. Okay. So the other thing is this use of community resources. And I just want to say something about the supervisor's role. Suzanne talked about inductive and deductive reasoning. An inductive reasoner, and part of that is most people are both, is to take a look at patterns you're seeing and try to move from those patterns. And that's something that we want to do with resources. We want to identify where staff are struggling and enlist the help of our agency and also DEMIS through Molly to get those issues resolved, right? So staff often need that supervisory support in order to make resources work. The other part of this is that staff need to understand that it is not time wasted to take somebody to an appointment, to sit with them in the waiting room, to teach them the process, to introduce them to a service person. Jessica, your eyes just got really big. Did you want to say something? Okay. Um, so that one of the things that we want to do is help people see that a referral is not a referral, just a referral is not necessarily a connection, and helping people make connections is a big part of this work. We also want to develop those relationships with partners, broker those relationships with partners, and so they're in a position that our staff are in a position to access them, and we want to advocate for people. Um, and Molly's just put in the chat, and this has been very helpful to programs in the past. And trust me, it is not snitching. Molly is very gentle with these providers, right? But the other thing is Demas funds a lot of these providers, right? And we want to make sure. So it's always helpful to tell Molly, tell her what's going on. She's going to ask you a bunch of questions, and she can help you broker some of these relationships. And it's made a huge difference.
I'm wondering what people are finding are the biggest gaps. We should have a poll, but we'll just ask a question. Where are you finding gaps in resources if people want to shout out or put it in the chat? I see Sylvia unmuted immediately. She's always so shy. She's
Why am
always
I
so
so
shy, that
surprised?
Sylvia.
Wait, Sylvia, where's that button? Put her in the waiting room.
Okay, put me in the waiting
I'm
room.
kidding. I'm kidding. I'm kidding.
No, there's two places that are really, really complex to get referrals into, and they're not DEMIS funded. Okay, DEMIS funded ones really understand about accessibility,
That's great.
but like the workforce boards,
Oh,
they
yeah.
don't have a front
Yes.
door that
Yes.
is helpful to our clients. And the community action agencies, it's a cumbersome front door that is not really as responsive as it needs to be. We can't have people, you can't call for services and wait 2 weeks for someone to call you
No,
in this field.
no,
Yeah.
especially in outreach, because by that time the person has moved on.
Yeah. And same with work. Like if they're like, now they want it,
Right.
please strike while the iron's hot.
Mm-hmm.
Right. Of course. Yeah. Thank you for sharing that. I think, as I've, learned more about the workforce boards, every workforce board is like its own workforce board. So you've got to work those relationships. I know you've done work, Sylvia, from previous conversations, to try and create those relationships. But the homeless world, even though they're supposed to, because they're supposed to be set aside of resources for people who have extra and high needs under WIOA, the outcomes that they get are not outcomes that make them look good. And I think they've been more focused on outcomes lately and less reliable. But that is a local resource and it's a local partner. So, even though they do have associations, it really is about creating a relationship and them figuring out how to work together with you.
So Molly just put in the chat that DMIS runs the individual placement and support, IPS, supported employment. These are for people with behavioral health issues, diagnosis of mental illness, co-occurring disorders, but that's available to you. And so that's something to consider. It's always good to sort of expand those resources.
I saw someone else come on. Anybody else want to call out a resource they're having trouble with or, struggling to access? I think the other thing that can come up and come out of the trainings and the communities of practice and the quarterly outreach meetings is for to identify patterns or things that are coming up in outreach that maybe are statewide. So if you do have things that are coming up regularly, it's good to feed that into kind of the conversation loop to see if there's something that could be done.
Mm-hmm. Okay. Okay, so workload management. There's a reason it's called workload management, not caseload management. It is really indeed workload management. And there are major tasks that people have to complete in outreach, including case management, but also documentation, teaching skills, those sorts of things, accompanying people to appointments, mentoring them through that appointment process, assisting people and making those connections to increase people's income, both from employment and also benefits, helping them locate housing, helping them choose housing options, and coordinating with landlords and resources. If there are there are certainly others, and they may be specific to your program. They may be things that all outreach workers do. So one of the things we need to do is help staff plan their time, right? And one of the things that Stephanie said is she goes over documentation Monday morning. Great idea, right? She pulls people all together. They have a chance to go through some documentation. They have a chance to ask questions. And you have a chance to schedule people to come back and do paperwork during the week, right? Because you're getting the assignments on Monday and then they have during the week. And I'm assuming you help them, figure that out so that that's something that we can really help people to do. We also need to be aware of sometimes one case manager is going to have every high acuity person, everybody on their caseload is on fire. And how can we get people help with that? You know what that feels like, right? And that how can we rebalance the caseloads? How can we rebalance some programmatic assignments? How can we either maybe pull somebody off a high acuity case or get them to split a high acuity case or something like that and give them something that really brings them pleasure? Like Suzanne was saying, this person might be an entitlements whisperer, and maybe have them do a little bit of training on entitlements to substitute in that. That is a different thing. You want to hit different parts of people's skill levels so they can balance that out. Um, the other thing is you want to really focus on the staff strengths. And Suzanne had said that, that they sent a memo out to the entire agency when somebody is placed. Some agencies do call outs in their team meeting, like, thank you, Myrna. I was really struggling with this SSI issue, and you came and you made some suggestions, and it made all the difference in the world. Or, thanks, Shannon. I was really frustrated, and the person was really frustrated, and you came and you just sat, and then your presence really helped me calm it down and helped me get a different perspective. It's telling people, recognizing people for skills, recognizing people for helping you, and that means the world to people. Um, you also want to pay attention to people's professional development. I did notice that in Connecticut in particular, a lot of people are in school. They want to have a conversation about some of the stuff that they're learning in school, and it directly applies to this. That's a really important thing. Giving people opportunities to go to conferences or giving them reading material. This can really help people in their professional development and also increase people's feelings of competency, which makes all the difference in the world. So really paying attention to that can be incredibly helpful and making sure that people have time for that, which I know is easier said and done.
So I just want to also say I think it's hard to rebalance caseloads
Yes.
because I mean, one thing that outreach has that you guys, I think most, because I visited almost a number of your teams last year, is you guys really work as a team, and a lot
Yep.
of people more than one person knows most people that you're working with who are unsheltered. But, you know, the relationships can be really slow to develop, and changing the caseload of someone or or the case manager for someone or the main housing specialist or whatever you want to call the position can really be disruptive for a person, right? So we want to think about rebalancing caseload. I think that's a really important thing to think
Hmm.
about. I especially think about my own career when I was a caseworker. I had all the hardest people. I was not afraid of anything, so that's okay. But I really shouldn't have had all the hardest, most complex cases. Everyone who was trying to get a transfer, and the ones, were aging out, and parents had terminated parental rights. But I was out there doing it. But I don't know that it was the best thing for my mental health or my mental work-life balance. And I think how we can try to keep an eye on that. And is it ending up that, you are using a team approach, but as people are getting enrolled in the program and really starting to work on a housing plan, is it always the same person? I don't know how you're making assignments, but thinking about that rebalancing really carefully, and also as you assign new people, right? So you might say, okay, Andrea's got a lot going on with the 4 or 5 people that she's really working intensively with. We've got psychiatric deterioration, maybe some severe substance use or something like that. When we are working to assign another person, we're not going to start with her, right? So we can also think about it as we assign new cases. But I feel like it seems easy, like we go, oh, okay, we'll just adjust based on acuity. But client relationships are so important, which I guess would make me go to the point of why it's important for the team to have a relationship with the client insofar as possible, more than one person,
Yeah.
to have a relationship with someone. And then maybe they can co-case manage someone and then do a warm handoff on the
Yeah.
team if the person really needs some relief, or maybe they're leaving because we have turnover too, right? And how does that happen in terms of transferring engagement? And the big point of the warm handoff is to transfer engagement. So if we're doing adjustments on these caseloads, we really want to just be mindful about maintaining the engagement and broadening the amount of people in every client's life, if we can. Because I know some of you got really small teams, and some of you have bigger teams, and some of you have a bunch of teams, and so it's not going to work the same everywhere. But I think it's an important part of being a supervisor.
Hmm. That's your favorite part of the job, right? Okay. One of the things we also want to do is really promote client and staff safety. And that just how we know that when people are scared and they don't feel safe, it's hard for them to move forward. The same thing goes with staff. So, one of the things that we want to do is we want to provide some guidance. The other thing that we want to do is you see that no cowboys thing? Like Suzanne said when she was 24, she thought she could do anything, and I admire the hell out of that, but it scares me too. And and I was the worst. I was absolutely the worst. You want to let staff trust you enough to tell you things. You want to talk to them about the benefits. And one of the most helpful things somebody ever told me is, I noticed how much better you are with clients when you can take a breath, when you can step back and take a breath. And I thought, okay, because that's all I wanted to do was be really good with the people that I served. So I think that we need to really help people to do that. We need to help them understand what the safety protocols are. We need to help them understand that it doesn't mean they're scared or it doesn't mean they're less than, and that most safety protocols have to apply to everyone. And there's a reason for that. And the reason is because if one person does something and the other person doesn't, then they're going to blame one person or the other, and that we are working as a team. They need to share their field schedule and update it regularly. And it doesn't mean that we're worried about what will happen to them with a client, though we always want to be cautious. But I'm much more worried about what will happen to them in the surrounding area and getting there and that sort of stuff. But I'm worried about everything so that telling people where they are, asking for help when they need it, that's a key element that we work on with the people we serve. We need to work on that with staff too, is it's a positive thing to ask for help. We want to check in on people on a predictable schedule. We want to help people talk about crisis. We want to really handle crisis. We're going to talk about this in greater detail, but we want to pull apart crisis not as a way to blame anybody, but as a way to do things better and be willing to take responsibility for some. Maybe the procedures don't need to be updated. Maybe things need to be updated. Maybe we need to talk about this as a team. It's not only the individual. Also, teaching people universal crises. The other thing is teach people how to be prepared. Sometimes people feel like, they really need to, they're under a lot of pressure. They really need to go out. We want people to review the client history. We want them to talk to people. Suzanne mentioned a warm handoff between somebody. If you're starting new with somebody, talk to the old worker, right? Do a formalized warm handoff or talk to the old worker, orient yourself to patterns, how people react. What are the risks? What are the positive things? What helps somebody calm down, right? You want to ask those questions because before you do it. The other thing around safety is you never want to meet with somebody for the first time by yourself out there, right? You want to do it either in a controlled environment or you want to do it with somebody else because there's a trust issue, right? Um, the other thing is build partnerships. Could be with local police, mobile crisis. Mobile crisis has been incredibly helpful to people. Other emergency services, know when they're going to show up, know how long it takes, know what you can ask them for help for, and don't hesitate, particularly with mobile crisis, to get consultation from them as preparation for going to see somebody. They may not come out, but they will happily talk you through it, usually. So that's something, I mean, if they're not incredibly pressed, right? But I think that that's something that we can really use. So we want to think about that in terms of safety protocols and how we talk to people about safety. And, a lot of people just don't want to mess up, right? And that the other thing is, something happening to one of the people we serve, that's terrifying to people. So we want to make sure that people understand that safety is for everybody, right? So
Right. And
we've
we're
got some,
going to,
okay.
we're going to do trainings, and we
Yes.
mentioned this last time. We now have some dates. We'll share them later in the session about going deeper on this topic. And really, it is about, the clients and the staff. And I think, I put this no cowboys in here because I think I've seen this a lot with outreach workers. I know this from my
Yep.
own past about being a little too bold and about going out or being in places. The recommendation I know in Connecticut is that people don't do outreach alone, but I know sometimes people don't have a lot of staff and or they might only somebody might be out or something like that. But we really don't want to reward people for taking a lot of risks. And maybe we don't even really want to laugh about it, even though
Mm-mm.
I know I'm making jokes about that and making visits to the South Bronx like I did in the dark at 9 o'clock at night to visit families who lived in large unsecured housing projects, right? And I was in school and busy, and that's when I could meet with the family at 8:30 at night in the winter. And you know, I was fine, but should I have been doing that? Maybe not. Did I talk to my supervisor? Maybe not. So, I'm telling this story and it really, from the perspective of also keeping the client safe and the staff person feeling safe. And while you may be comfortable doing something, and Andrea made this point, like, so if I make the home visit at 8 o'clock at night in the
Yep.
South Bronx and come to the apartment, well, that other worker, she would only meet with me from 9 to 5, right?
Hmm.
So then it sets up a split on the team.
I want to say something else about cowboys because I've had a lot of experience, personal
And
experience with that.
she was a total cowboy. Let her She can lie all she wants,
I'm
but
not gonna lie. No, I was a total cowboy, and that's why I want to say this. There is an adrenaline rush that comes with that, right? And it's addicting. And so that's something we want to take and talk to people about, right? Because part of it too is you can get some of that same feeling from feelings of competency, feelings of other things, and you want to talk about it and you also want to acknowledge it. But you know what? Being a cowboy is pretty fun. Not for anybody else, right? And it's fun until it's not, but we need to acknowledge that. Okay. So we've got some resources for you. There's a sample agency safety protocol, so you can plug in to that. There's a policy and procedures, so you want to look at it. There's also some resources, things like mobile crisis, that sort of thing at the end of it. So that's really important. There's a client safety checklist that is really important, and that one of the things it has questions. The safety client safety checklist has questions you can ask people in different categories, everything from, interpersonal violence safety, safety from interpersonal violence to weather to, overdose risk. There's a lot of that in there.
I'm
Great,
sharing the checklist right now.
great.
So what we found in the monitoring is that some people are not familiar with the resources, some people are familiar with the
Hmm.
resources. So we wanted to make sure people know the resources exist. So this is a short, so of those links, this is just a short checklist. You can actually print it. It's just a couple pages. And then there's other versions, but let's just walk through this first and
Hmm.
then we can share the other tools that exist for this. And because it's important for you guys as soups to know they're here. We'll go over this in the safety training again, but definitely wanted to make sure they're on your radar.
And they're good categories. Things like, transportation hazards. Do you sleep or walk near roads or train tracks? It's not a question I would automatically ask. And I think that those are good questions. I think these are good questions. Um, and it also says if you see somebody's at risk, what can you offer? In this case, it's reflectors, it's safer routes, it's rail and highway tips, right? In other ones, it's, hygiene support, it's access to food, or with the interpersonal violence, it's DV trafficking resources, those sorts of things. So it connects what we can offer to people to the risk assessment, but I think it's pretty helpful. Mental health one, feeling very stressed, hopeless, disconnected. These are questions you're going to ask. You're going to ask them in a different way, probably, but it's a good checklist to sort of think about what you want to talk to people about. What do you think? Have you used it? No? Did you think
I
it
think
might
it's
be
written, and
helpful?
just as I'm thinking about using the tool myself, it's written some as like written as if you're asking the client. Some
Mm-hmm.
things you may observe that, right? Like you can ask
Yeah.
them if they have reflective gear or lights, but you could see that they don't, right? So it's kind of written that way, but I think it's meant to really be more of a checklist. Like you might see something, you don't even have to ask the person, what they think or to answer it because you know the answer already.
So Courtney says, can this be edited to have safe spot, which is the 1-800 number if somebody's at risk of overdose, prevention for the overdose prevention line on it? And Molly said, yes, of course. So this will be changed to add that. And any
Yep,
kind of
this is a tool
resources.
that we make. We make
Yeah. So any
It's a
kind of
tool that we make up, so we'll adjust it.
resources that you have that you think might be helpful under this context, please feel free to let us know.
Well, and if
Okay.
there's other questions or checklist items
Yeah.
that you think should be reviewed, things that you're seeing out there, based on the kinds of things that are going on in Connecticut. Um, and then so this is the checklist. This was linked in the slides. This is a longer version of that has some narrative. Again, think about your staff. Some of them are going to want to read the whole thing with all the prompts. So this is really that safety planning checklist, but there's a little bit more background for people. There's some kind of sample assessment questions, so that goes beyond just that checklist that's there, and a place to enter information and document risks. And that goes through all the same categories and things that you're going to do. So this is really a plan, right? That checklist, I think you can use workers can use that as a quick checklist out in the field all the time. But for some people, it might be good to really, and especially people who are staying outside for a while, to really make a plan and use
Mhm.
this tool. And it may take multiple meetings to do it. I see some things going on in the chat, so I don't know, Andrew, if there's any comment on this, but I don't know if
Mm,
people have used it, but if you have feedback, again, as Molly said, we're here to make this better for you. But if you have feedback or thoughts you want to share, so I'm just scrolling through to
Shannon
see if
put the link into it.
yeah.
Shannon put a link to this in CT Boss.
Thanks.
Yep.
Okay.
Okay. There is also Demas reporting.
I just want to, before you move
Oh,
on,
sure,
the
sorry.
other thing that's in here is in the third link in this slide is a policy and procedure for your team. So this was
Yep.
written originally for Path, but you can where you kind of need to just go through and tailor it to your own agency. So it's meant to be a support to you and again, a resource, but let us know. But it did come up a lot in the monitoring and we know people are busy. But it's going to help everybody feel better if you have a safety plan and everybody is going to worry less about a safety plan if everybody has a safety plan. So, okay.
Okay. Suzanne mentioned there's an upcoming training on safety, and we're going to use parts of this session to fine tune that more. But I think that that will be helpful. Let's talk a little bit about incidents, right? One of the things about incidents is you want to define them, and then there's a debriefing that people usually do as a team. There might be an incident review in your agency. You want to make sure your protocols are holding. Did people adhere to the protocols? Are they working? Do you need something else? Making recommendations. You want to always focus on what went well. Be aware that the case manager who is involved in the incident is probably going to feel bad about it, right? So you want to make sure that you're balanced, talk about what they did well, talk about what could have been done differently if they have suggestions, right? Um, what may need to change. We talked about that for a minute. Do you need additional training or resources, right? And then what do you need to notify DEMIS about? And this is a link and it tells you, what are the things, what's the reporting protocol for each of these incidents? And it's available to you there right there, right? And there are specific things you need to report to DEMIS. Obviously, if there's a death, if there's a serious injury, there are things that you need to report. I know that, if a staff is injured, that's something you need to report probably to DEMIS, but also to your agency. So you want to know what the protocol is. I've always said that these safety protocols are really helpful to staff because I want them to concentrate on the people we serve when an incident comes up and not have to be searching around to see what they do next. So if there are requirements or if there are things or there's a process, you want to make sure that the staff are acquainted with it ahead of time. They have all the documentation they need. They can do it with their supervisor so that they don't have to be searching around for that and they can really pay attention to what happened to the people involved in the incident. Okay.
I also just want to flag this is like obviously a worst case scenario, but want to make sure everybody knows this is on the table. If any of your programs experience a participant death, mobile crisis teams are happy to come in and do like debriefing
Mm.
with people. So please know that that exists, is available, is something that the local mental health authorities are willing to do, have done for many of the provider agencies. It might not be top of mind as an option, but sometimes it's really helpful to get some third party entity in to just provide a little bit of space for people to process. And that's something that the mobile crisis teams have offered and are willing to support with.
Molly, we've gotten really good feedback from a couple of outreach teams, right, who have used that service, and it's been very helpful to them. And a lot of times, staff wants to hear from somebody who is not you, right? So that, I don't know, that was my experience. Yeah,
Well, and there's strategies and interventions to help people with debrief and
yeah,
to support them in processing that grief. And as a supervisor, you're doing a lot already.
yep,
Uh, and I would love and welcome having somebody who could come in and
yeah.
do that for the team so I could be a part of it as well, right? So that you could
Yep.
actually benefit because we're all going to grieve. Anybody who knows that person, even if we didn't know the person, we might be feeling bad or have feelings about the passing. And it could be a client, it could be a staff, right? It could be either one.
Yep. Yep.
Those kinds of things. So thanks for sharing that resource. We'll make sure to put that in the training, Molly, when we're working on that
Yep.
safety on outreach. Okay, thanks, Shannon, for putting all this stuff up in the chat. Okay, hadn't looked at the chat in a while. Right.
Yep. The other thing is to provide a support to staff in the moment. People are going to feel guilt, powerless, incompetence, and all sorts of things. People are unprepared for when things go badly like that, and that, no matter what we do, people need support and comfort, and they need a little bit of distance, as Suzanne has said and Molly had said, to really process this. And processing is how people help get through this. People are also afraid. Their experience with supervision, their experience with senior staff in the past might have been a blaming situation, and they're worried about that. So, just reassuring people this is going to be a productive conversation, showing them, mentoring them on the productive conversation, and, making that part of the culture of your agency so that staff can tell each other that this is the way that things are handled. People may also, be experiencing some trauma from this. They may fear going to work. They may fear going out in the field. They may fear similar situations, and helping people work through that, making accommodations for it, or also helping people decide that they might try something else because sometimes it's too much for people. The other thing is that, some of these incidents can cause changes in relationship with coworkers, with clients, sometimes even with supervisory staff, and sometimes it's for the better, sometimes it's for the worse. You want to, create a culture where people can support each other, but it's very difficult, and that's part of this, right? And that oftentimes crisis will change that relationship. And we want to be able to talk that through and have people get through that.
I think we want to also be upfront and out
Yes.
there about saying all these things, like that these are normal reactions when something happens, that people feel these things, that people are afraid of criticism, that maybe in your last job, and even if they were in human services, I was just talking to someone who's working in a human services agency where it's all about criticism and
Yep.
really saying that the purpose in your program is to learn how we could be better, right? And it's not a blame game. I use those words directly. Personally, I say, we're not having a blame game. And if that feels like a blame game here, then we need to stop and you need to call that out, right? So we want to be assertive in putting this out that it's normal, that these things are normal, that you might be traumatized because people have had histories of trauma that we don't know about
That's right.
and that sometimes happen. I mean, if someone overdoses, just for example, someone may have had someone in their own family who overdosed, right? We don't know that. Um, and also normalizing that you might need a break and encouraging staff to take a break or maybe not go out on outreach for a week or two and take, a little mental health break, but maybe they're working on catching up on their documentation or something during the in-office times. And having a forum. And I think the one thing that we will talk more is these are, I think, standard questions in an incident debrief. Well, could have been differently. I just want to say there's a second part of that sentence is what could have been differently to have an even more effective intervention, right?
Yeah.
It's not because
Yeah.
we failed, right? To be better going forward. Even in a great intervention, we still might identify something that we could do better the next time. So I think that's also in terms of avoiding the blame game for people and engaging people in problem solving around because when an incident does occur, we want to think about how could we prevent it from happening again. And I think some of you might have had incidents in your common space or in your program space. And then, what do you do afterwards to kind of reclaim that space? So there's in the office, there's out of the office, there's out in the field, there's the client safety, there's the staff safety, and they're all together. So it's really a huge topic, and not talking about it afterwards is probably the thing, that's the lowest thing to do, right? The last thing to do. Really want to be out there.
Yep. So we are going to break people into groups, and that there's always that introduce yourselves, but it's probably going to be the same sort of groups. And then, if you can talk about what sort of safety issues you're seeing for clients, what sort of safety issues you're seeing for staff, what are the things that come up, what are the things that keep you up at night, what are you worried about, and what's your process for responding to incidents? And what's your process for debriefing at any level, right? So that's really important. And if people could, we're going to break people up into groups. We are going to share the slides and we're going to. Thanks, Shannon. Welcome back. Was it a helpful conversation? What are the sorts of things you all are seeing?
As we said, we're going to do a 2 sessions training
Right.
in June. You'll have the date soon. So it'll be helpful to us to hear a little bit more about what's coming up in the field.
Yep.
We know you like to be helpful. That's the kind
Hey, Myrna, something you said really resonated with me. You want to talk a little bit about stuff that might be coming up, especially around maybe the people you serve misunderstanding the relationship. It's something that happens with low boundaries and also power differentials. No? You guys in group one, you want to talk about that a little bit, or did you have something else you wanted to talk about? No?
Um, you know, there's a major issue with a lot of clients that we do deal with because of the mental health and stuff like that, and the assuming that there's something going on, with clients assuming, a relationship or something with a staff,
Ah, yeah. Yeah. That's a
you
good
know,
one.
and we had an incident like that could have got out of hand if we didn't resolve it like kind of quick, where that the staff member were really scared and really was unexpected of it,
Mm-hmm.
that the client really felt like that because
Sure.
she didn't see no signs of it, but it was something that we had to start looking at the safety of the staff as partnering up with somebody, walking up to a car, because where we're at,
Mm-hmm.
we're not in a parking lot right there where that we could just walk from the building to the parking lot. Sometimes we got to walk a block, maybe 2 blocks for parking.
Mm-hmm.
And we start partnering up with staff, partnering up together, walking with her, and even talking to the client about the issue where the client was in denial about everything, but an incident did happen where that it was him by her car, looking at her car, following
Mm.
her without her knowing it, but he really didn't make no advances of threatening her, but it was just obvious that he was watching her.
It's uncomfortable, right?
Yeah.
It's really uncomfortable and it brings up a safety issue. And when people assume a relationship that's not there, it's hard. And we realize this is that sometimes you're the nicest person to them ever, right? And they attribute it to other things. There's also a
Yeah.
lot of transactional stuff that goes on in homelessness is sometimes people, trade favors or trade pieces of themselves for safety, that sort of thing. So it's a way that people relate to people who have power, who can provide them with things. I mean, it's very confusing for people, and really working that through with staff can be really important.
Did
But
the staff
also,
report it to you?
say it
Did the
again.
staff, I'm asking L. Jordan, Mr.
Yep.
Jordan, did the staff report it to you? How did you find out about it? I'm just curious.
Yes, staff reported ASAP.
Great.
Yeah. They kind of felt something doing work, but it wasn't really no sign.
Mm-hmm.
She kind of felt something. And
Yep.
then once it happened, it was like, wow, it was really scary, at that time. because when you're not expected that, especially as a female, for something like that, and it was kind of scary.
Sure,
The
of
other thing
course.
is it's good that they came to you. That shows a lot of trust, right? But the other thing is Sylvia's comment, not
Right.
specifically this, but at everything is staff has to see their gut as their superpower and really pay attention. And if you think something's off, get help. And that's a really good sign is that they came to you for help. And they felt like they could.
So Sylvia also added to the chat, and it was not in our training, so we appreciate it. It's in the checklist, but
Yep.
we don't talk a lot about unsafe weather, but the weather is definitely a safety issue and then the losing your belongings. So people get robbed or people get things stolen from them.
Yep. And that's a risk. When people feel helpless and they feel like they don't have control over that, yeah, phones, medications, that sort of stuff. When people feel threatened like that, it can lead to people reacting to that. We want to be careful about that. We want to help people. Sylvia, what sort of things do you do to help people safeguard that sort of stuff, those sort of threats?
We talk about what can you do with it. We do give backpacks out to people. I mean,
Great.
everything that we can get. Now, Demas gave us some lockable medication bags. I
Mm-hmm.
don't know that those are really solving the problem, but they are good when you're in any kind of situation. People can't take your, stuff from you if you can lock it. It's like a pencil bag,
Mm-hmm.
the pencil things. But we were what we try to do around all these issues is, unfortunately, we have had to beg, borrow, and steal to have things to give people. I mean, when we used to have only like 100 homeless people outside in our region, now we have 1,300,
Oof.
and our budgets haven't changed. So we are basically looking under every rock to find something. I think that's also a safety issue for me because Barbara knows one of my staff is on here. She knows I always come up with something, but I think my end is coming. I don't know. I mean, I'm almost at the wall where I can't come up with filling
So
the
true,
report,
so true.
right, Barb? Like, I don't know.
Absolutely,
Yeah,
absolutely.
we always figure it out somehow, but we're getting close to not figuring it out.
It can be really frustrating for people too, for the staff and for the clients if they're used to getting the things that they need and that, yeah, it's finite, right?
Yeah, well, it doesn't even exist to begin with. We're
Yeah.
just very creative,
Yeah, I know.
Barbara,
and
did you want to say something? I saw you unmuted. Did you want to elaborate a little bit?
No, because Sylvia, I'm always begging, I'm always advocating for my staff and the clients, so she knows what she's saying. I agreed with her.
Okay.
well,
And I
she's
think
my
this,
biggest safety risk, Barbara, saying no to her.
Huh.
don't don't say no to Barbara. I'm getting that message. What about
Absolutely.
debriefing? Is everybody
Yeah.
debriefing stuff? Is everybody debriefing when things happen? I hope so. I
You
think
know,
it can be hard. Who wants to go back over a bad situation? Sorry, Sylvia, go ahead, please.
you have to always ask this question: did anybody die because you did it on purpose? Okay, like once you can say no to that question, which you usually can, you say, okay, I don't want
We
people to
can
fear.
probably resolve this. We can get through it. That's what you're
Right.
saying.
Like, I don't want people to fear telling what happened because they're afraid they
Yeah.
work somewhere, which you guys talked about, where
Yep,
people
Yeah.
play blame game.
yep,
We
yep.
just want to say we can deal with it.
But we can only help if we know.
When a client doesn't achieve a goal, it's a learning experience, right?
Mm-hmm.
We can learn from this. If not everything went 100% according to plan, okay, what can we do, going forward? But let's also look at what did go according to plan. but we need to be flexible and kind of model that. And I think that having a regular debriefing process, whatever it is, and structuring that just the same way as when Stephanie talked about um, every Monday, we talk about, paperwork. Every quarter, we have incident review and some structure. And we'll talk more about this when we get into the training, but having a structure that makes you to have those conversations so you can debrief it. Because sometimes you just want to like put it behind you. The guy we managed, the Narcan worked, he didn't die, but Steph is still traumatized because they went to that guy's tent and he was overdosing. And maybe
Hmm.
the Narcan worked and everybody's joyous and but it's still traumatic, right? And it still brings up a lot of feelings and of like, why didn't we go an hour earlier? And,
What could
whatever.
have happened? What could have happened? Oh my God.
Scheduling it. So think about that is, do you have a core? I am a structure person. I like structure. It helps me get things done in life. At the beginning of the year, I'd set 4 meetings. If you don't need it because you didn't have any incidents, fine. No debriefing needed. I mean, you want to do an immediate review of a situation, but also kind of good to step back on a quarterly basis and take a look at, is there anything we need to change in terms of priorities? Okay, I think we need to move
Yep.
forward unless
Yep.
anybody else wants to talk. I think you're still,
Yep. I'm on. Okay, the other thing about offering staff training, you want to think about individual learning styles, the inductive, deductive, how people learn. Some people learn by writing. Suzanne went through a lot of that. Um, you want to help people shadow experienced workers, see how other people do it. And as a supervisor, one of the things that the staff liked best and felt like they learned the most from is when I messed it up, right? And that everything's not perfect. And it took them about 2 seconds to figure out that. But I think that that's a good thing to happen is let people see your struggles and let people see people. And the other thing is put on markers like everybody should go with an experienced worker the first time they do a home visit. Those sorts of things really help people. Um, learn what the job are and home visits are different. You want to also review programs, policies, and procedures on a regular basis. Nobody's taken down that policy, well, maybe one person is taking down that policy and procedure manual and reading it, but I think that going through policies and procedures, particularly ones that have come up in your staff meetings so that people get familiar with that, can be incredibly helpful. You
and
want
taking
to
it like one at a time
yeah.
because it can be overwhelming. The policies and procedures manual, it's too big, it's too many pages, and I'm a reader. Let's just go over, here's this particular policy. We're going to review this in team meeting for 10 minutes to make sure everybody understands it. So making it manageable for people, because I know I've been in jobs where they said, go and read the procedure manual. Well, even though I read it, I did not remember it because it's too much. There's too many details. It's too much to read at once. It's like eating an elephant, right? You can't do that
Ugh.
all at once in case you ever tried. But we need to figure out how to get that to staff. And again, breaking that down into pieces can be helpful.
Helping staff meet community partners, talk to community partners, get to know what their agencies do, get to know what services, get to know how they can be helpful. Molly gave a great example of mobile crisis, doing some debriefs. You want to use warm handoffs so people can understand how people calm down, what people react to. You also want to explain the documentation requirements and why documentation is there. The why of documentation is to make things more consistent, but it's also to give people guidance. And documentation can be a help to people, but unless people see it as useful, it's hard for them to use it. You also want to do some training about a program overview, talk about your program, best practices and street outreach, program policies and procedures. We talked about that, and a plan for ongoing training. So this is the street outreach training inventory. They're web-based, and the trainings are available on topics that include best practices, engagement, homeless response system, housing options. I'm not going to read them all to you.
No,
But
yeah.
these are all, yeah, I know. I could see Suzanne's getting nervous. Oh God, is she going to read that whole thing? So, all right. So that I mean, people find these really helpful. They are web-based. Some of them are self-paced, but most of them are recorded. Having somebody else sit with them or debrief the training with them can be helpful, especially to new staff, so they understand and take it in. But this can be helpful.
We're
And
doing
that,
trainings as a group in a team meeting,
yeah.
maybe revisiting some of the topics that are particularly coming up in the work. There's a lot there that list doesn't even include everything. I was like, oh, it's missing this and it's missing that. There's a lot of resources for you, and want to make sure you're just getting access to them
And you
all.
can click on that street outreach training link at the top that's underlined in purple, and it'll give you the list. The other thing is we've been doing these street outreach, best practices in street outreach. These are the sessions, where the slides are, the recordings, and the first supervisory training was on there, and our next training will have the second supervisory training, this one on there. So just in case you missed it, those are always available to you, and those are always available to your staff.
And we are going to do, and I meant to mention it here when Andrea mentioned documentation, that we realized as we started to include it in this session that it made sense to do a session on documentation and
Yeah.
data each supervisors. So we're actually going to do pull together a session for specifically around that topic for you guys and anybody direct service who wants to come to that. I know Andrew is dying to do this, but there is a learning manage. I'm going to pick up here
Thank
on this
you.
topic. There is a learning management system for HMIS. I don't know how many of you have gone in. We should have a poll. How many of you have gone in as a supervisor to the LMS for HMIS? Sylvia's nodding her head. I'll take one yes. Anybody else? Yes. Stephanie's nodding her head. All right. So we have two, at least 10% of the group has gone into the learning management system where you as a supervisor can look and see staff, see their enrollment, see the trainings. And so this is a step-by-step guide here for the HMIS data coordinator. So I guess you have to have that permission to be able to see this. So I don't know if that's a special thing you have to talk to Nutmeg about. Luckily, we have a link because I'm not an expert on the Absorb system, but we wanted to make sure that you all knew that it's there. You can start assigning staff to sessions, and you can, let me just go to the next slide. This is the how to assign people, and you go into the learning view and enroll people, choose the staff, select the trainings, and finish the assignment. So it's possible in there to make sure staff are getting the HMIS. I understand a little bit from the monitoring, there's some issues with data entry, and so don't ask for me for help. Use the support form here if you need help, if you need getting out, getting access, if you can't see all of your staff, if you're missing courses, if somebody's blocked. People can get blocked from enrolling in a class. But reach out. The link is live, like Andrea said. All the underlying links in the training are should take you right to an LMS support form. So hopefully you're using that so people can, and we're going to talk about enrollments and such exciting things as enrollments versus, I forget what it is, but I have to study up on that before we do it. So the last thing I just want to talk about today, even though it isn't specific to outreach, we're really focused on reach specific stuff, is about professional performance reviews and professional development. And we've rung this bell from the beginning. So part of the Caducean model is supporting staff, but also helping people develop professionally. That's a perk we can offer them, right? And many of you have master's level staff, so you can supervise field placements if people want to go to school for different helping professions. But performance reviews are a part of the professional development process. I know it's another thing like supervision. I think what was I most behind on in my paperwork was staff evaluations because you have to uh, write it all down, and you're busy with a lot of other things like clients that take your priority in your head. But it's really important to give people feedback. Again, that positive reinforcement for what people have succeeded in. You can't be telling people too often, although some people may say you can, but that they're doing a good job or pointing out what they're doing well. Because people need gas in that tank to keep doing this work. It's pretty hard. But we want to give people feedback on those strengths. We want to also identify areas for growth with them. Same way as with a client, but we're really looking for what are their goals. Is what is this person's goal? Do they want to be a trainer? Maybe they want to get better if it benefits. Maybe they want to be an employment specialist. Maybe that's their interest. Maybe they want to do a lot of work with people who are recovering from substance use. Maybe that's an area that they want to learn about. I know when I was a young worker, that was really interesting to me. So thinking about areas for growth and opportunities for people to develop, and then giving them some paths to get there. Maybe we can get classes at a college. Maybe our agency has an in-service training. Maybe you want to tell Molly and team that you need what subjects you need more work on, and we may be able to help you with that. And of course, if we have deficiencies, I mean, we shouldn't really wait for performance evaluation. If people are deficient in their performance, it's kind of a crappy part of the job as a supervisor, but people deserve to know when they're doing things that really they need to stop doing. And clients deserve that, and staff deserve that. And I know that it's never fun to say to someone like you were really over talking over that person and you didn't listen to them, and not such fun to give that kind of feedback, but people talk over clients. That's actually something that maybe does result in a safety issue, right? Because the person's feeling steamrolled and listened to and maybe a little traumatized. So the feedback that things that people need to really do, or they're not entering any clients in HMIS, or if they're not doing their documentation on a regular basis, which I think is probably more likely what you're going to see. Again, celebrating those accomplishments and developing some professional goals. So, even though you might not like it, I just wanted to give it a plug and also come clean that it was something I was always late on, but our agency had a person who came behind you, kept knocking until you got your performance evaluation. So somebody has to keep knocking to say those just the same way you get a flag, service plan is due or something like that, that you get a flag. No, lordy, lordy, we may finish early today. That's because we created a whole nother session with all the other slides we were going to go over.
Yeah.
So we didn't have to speak talk. And I think that, you guys all know this, and I think it's been threaded through this, that leadership, we're not talking about being the boss. We're talking about providing leadership to people and really engaging in the same as clients, modeling a trusting relationship where we're working together with the people that we're supervising, even though we are the boss, we're all joined together. So the supervisor is essential. You guys know we have a ton of respect for your work, and that staff can't do the job without you. And you know the things to focus on, but there's a list in case you forgot about all the things you have to do. But don't forget to have some fun. We want to continuously strengthen performance. That's the continuous quality improvement, or it's this, you know, achievement of excellence, however you frame it in your organization. That's not a bad thing. People like that. It makes them feel good. Focus on what's priority. Make sure everybody's safe. Build a motivated and fun team. I know I met some of your teams and they seem fun, but have some fun sometimes. Don't forget that. Help people learn and grow, and try to hold on to people. So as I already mentioned, we're going to develop another session for you. I know you're dying for it, the documentation and data for
Yeah.
supervisor session. We're going to work hard on the jokes for that session for all of you to keep it engaging. And we've got additional resources. So if you haven't found the standards yet, the outreach standards, they have very specific actually standards for program managers. And supervisors. So you may want to take a look at that section. We've been weaving that in, but go to the standards. The next community practice is June 4th, 10 o'clock. That's with Andrea.
Yep.
The outreach quarterly meeting. The next one is June 10th, and you see they're scheduled for the rest of the year. And that's Molly's big meeting of everybody. And then you'll get in an invite by the early next week for doing safety on outreach, and it's client and staff safety. And we kind of build out much more about how to just create not only physical safety, but the whole kind of safe space to work in, safe space for clients, safe space for staff. So that'll be in June, and you'll see an invitation soon. We have our references as always, and oops, sorry, skipped through. Reach out to anybody whose name is here. You may know some people better than others. You may have, you know, connections. So feel free to reach out on for any questions or things that come up in the future.
I just want to say
And
that
yeah,
Suzanne mentioned the safety training, and we talked about some of the safety issues that are coming up. But if you think of ones that would really be helpful to cover, if you'll email them to us, that would be incredibly helpful. So if you're feeling particularly generous, we really appreciate it.
okay. So it's a record day. We really finished. So you guys, I'm sure we'll find something to do with the 9 minutes because I'm sure I think people are waiting for you already. We just want to say thank you
Yes.
for coming, for being with us, and we'll see you soon. So if you want to turn on your
Thank you.
cameras.